what recommendations do you have to look for or questions to ask in order to find a provider who would be helpful with someone dealing with PCS when there are none of your clinics within hours of travel? So our clinics, she's referring to complete concussion management clinics. This is exactly what I was saying earlier in my intro, is that finding good concussion care is difficult. We know that there aren't, it's not something that's taught in medical schools. It's not something that's taught in PT programs. And so there's a lot of healthcare professionals that are out there that don't really have a good, strong understanding of concussion because they never really learned it as part of their school. So you're really looking for somebody who's taken additional training in concussion. Now, the problem is not all training programs are created equal as well. So it's really difficult to say. The reason why complete concussion management exists is because there was really nothing out there that was providing a decent education on this. And so that's why we stepped up. So to provide you with recommendations, I think the thing you want to look for is reviews from people who've been there, like, people who would say, yes, this was good, I had success with this. Look for people that have kind of a specialization in this area, that they see a lot of concussion patients. Evidence base is a huge thing. So relying on scientific evidence, bringing up studies that have been done and things like that to show that they're actually keeping up with the literature, because there's probably 400 studies a month published on concussion now, and so the average person keeping up with that is just not gonna be able to. The other thing I would recommend is maybe send us an email for the patient course. So send an email to info@completeconcussions.com and put the subject line as patient course, and we'll put you on the waiting list for that, because that might just give you a little bit of insight, might help direct you a little bit. Unfortunately, a lot of people just get sent to general PT after a concussion, and finding somebody who really knows concussion, it can be quite difficult, which is again why we started the course. So again, things to look for things like they do a treadmill test. If they're doing a Buffalo concussion treadmill test, it means that they know something about concussion. Don't just go for general vestibular PT, because there's a lot of basically they say that only 25 to 50% of patients with dizziness after concussion are going to see benefit from vestibular PT alone, because dizziness can be caused by eye issues and neck issues and stuff like that as well. So sometimes that gets missed in just going traditional vestibular PT. So try to look for concussion specific training, particularly from a rehab professional.